Good evening. My name is Juanita Charles, and I am founder and CEO of Manifest Magic Black Girl Cooperative. We're really excited about really just celebrating Black Maternal Health Week this year. With that being said, we have a very special guest whose work is focused in that space. And so, with that being said, I'll let you introduce yourself.
Yeah, thank you so much, Juanita. I appreciate the invitation, and also to be in conversation about Black Maternal Health Week. I remember when the week first started a few years ago and being one of the first organizations or being part of one of the first organizations to celebrate the much needed week. So thank you so much for the invitation. But
Absolutely.
yeah, my name is Briana Perry. I am based in Nashville, and I am currently the interim executive director with Healthy and Free Tennessee, statewide organization that's working to grow a movement for reproductive justice across race, class, and gender by, bringing organizations together, developing skill sets and capacities, working to dismantle harmful systems, while we also are working to envision and build new liberatory structures that supports the livelihood and the well-being of all Tennesseans. And so our organization first formed in 2012, and we officially got off the ground in 2014. So, been doing, some work for some time now. And I have been connected to the organization since 2014. So shortly after or a year after I graduated from school, was really invested in reproductive justice work in college. And then I moved back home to Memphis and got connected with Healthy and Free and some other reproductive freedom and justice work. And yeah, I've been connected ever since. Like prior to me being interim executive director, I was co-executive director for about 5 years. Really grounding the organization in dismantling white supremacy, thinking about resources and support for Black mothers, Black communities as well, fighting back against criminalization when it comes to pregnancy outcomes and also the criminalization of parenting, which also is a big issue in Tennessee.
Oh my goodness. Like that is, first of all, can I say how amazing that is? But it's really just beautiful. Like the work that you do is beyond needed, especially when we see the state of Tennessee and the legislation that we're trying to push, they are trying to push, let's be clear,
Mhm.
and how harmful it is to all birthing people. And so with that being said, I really appreciate the work that you do and really just looking forward to hearing more about it. So you had mentioned reproductive justice. Can you tell us exactly what is reproductive justice?
Yeah, absolutely. So one thing I will say is that this year will mark the 30th anniversary of the framework. So it was developed in 1994 by a group of Black women responding to the, supposed healthcare reforms from the Clinton administration, but really wanted to push for something more expansive and really spoke to Black communities and like moving past like how reproductive rights like were framed, and especially thinking about the rights to abortion, but being more expansive to think about what it means like when it comes to access and how our choice when or a set of choices when it comes to reproductive and sexual health are structured, are informed by larger systems. And it's not just like, oh, I'm gonna choose to maintain a pregnancy or terminate a pregnancy. It's like, what are the conditions of my life, and how that's also historical, thinking about the systems that have impacted Black people for generations. So, white supremacy, patriarchy, capitalism, and how that informs the choices that are available. And so, really excited about this 30th anniversary and how like RJ, founding mothers really wanted to develop a framework that really grounded these issues in our human right and like centered like marginalized communities. So there are three core tenets to reproductive justice: the human right to have a child, the human right not to have a child, and the human right to parent children in healthy, sustaining, and thriving communities. So it's really kind of like a marrying of abortion rights with social justice, and thinking about like all the resources and supports that we need when it comes to like reproductive and sexual health, kind of like across the spectrum, and like how that relates to like, like establishing families, trying to have families, terminating pregnancies or preventing pregnancies, and then also like what are all the supports and resources that are needed for our families and communities to be able to raise them. And so with that tenet, and there's also like, a fourth one that was like added after 1994, kind of like the human right to bodily autonomy, free from all forms of oppression.
Oh,
And
beautiful.
so when we think about all the things that we need in order to be in healthy and thriving communities, that includes housing, that includes education, jobs, access to clean water. So all of those things
Yeah.
are reproductive justice, like as well as again the ability to terminate the pregnancy, and also like birth justice, like being able to have children under like the set of conditions that make the most sense for us and they're the most supportive for us. So having access to midwives and doulas and all of that's also a part of reproductive justice.
It's so interesting, like just listening to what some of that framework is. So our organization, we actually just got done reading Hood Feminism. And
Mm-hmm.
and so sometimes I think when you think of things, you think of them almost in a vacuum. And then so when you think about all the pieces that go together, especially when you're talking about your three core tenets, and of course the fourth one, like when you put them together, it's one of those things where you recognize like family planning is not just family planning, right? You and not it is not only centered on that child, like you said, it's centered on the conditions in which you're going to raise them, and all of these different things. So I just think that's really, really, really powerful. So I know we talked about the framework, and obviously you're based in Tennessee. So when we talk about the state of Black maternal health in Tennessee, like how actually let's talk about what is the state of Black maternal health in the state of Tennessee.
Well, one, I will say, in a big piece of Black Maternal Health Week is to like shine a light on like the state of
Yeah.
Black maternal health of for all like Black birthing people. And of course it's like really highlighting the statistics that we have seen represented nationally, how it's impacted Black birthing people across class, like what happened with Serena Williams and just like other Black folks who they're trying to have like a healthy pregnancy, healthy birth, and then things happen, and like what can be the impact, or what is the end result, and
Yes.
how this tied to Black maternal mortality. So one thing to uplift when it comes to Tennessee, that the rates are similar, like it mirrors like the national rates. Black women are dying 2 to 3 times the rate of white women. And infant mortality, something I want to uplift as well, is higher than the US rate. So even though like the infant mortality rate has dropped, it still exceeds the infant mortality rate in the US. And so I think about places like Memphis, where I'm from, my hometown, and just like a few statistics I want to share. So in 2004, Memphis ranked first nationally with a rate of 12.8 overall and an alarming 17.4 for Black infants. And so again, even though there was a decline, it still, has been higher than the rate in the US. Also, some other pieces. So in Tennessee, the preterm birth rate among Black women, and these statistics are from March of Dimes, like a few years ago, for Black women, it was 44% higher than the rate among all other women. With when it comes to coverage, so around 50% of births in Tennessee are covered by TennCare. No, of course, it's the Tennessee legislature has voted not to expand Medicaid. I will say a few years ago, the Tennessee legislature, after like, a huge push, approved a budget to include funding to extend TennCare postpartum coverage, because we
Yeah.
know like with Black maternal mortality, we're really looking at that first year, right? And if people, and we know this was the case, they were only getting coverage up to like 6 weeks. And it's like, okay, what about that parent, like something comes up in
Yeah.
the 8th week, the 10th week, and they're not able to have coverage, what does that then mean? Like, it's initially just 60
Absolutely.
days. And so that went into effect in April of 2022, but just the fact that like it was April of 2022,
Yeah.
and that, being a thing. And
Yeah.
it should have happened, way before that. 47 of Tennessee's 95 counties lack access to an OB/GYN. And we know that Tennessee has like led the country in rural hospital closures. And when hospitals are about to close, like the maternal ward is the first to go. And so people really not having access, and how that's also tied to prenatal care and some statistics, around that, like, people receiving no prenatal care or inadequate prenatal care. And so in 2019, about 1 in 6 infants was born to a birthing person receiving inadequate prenatal care in Tennessee. And so just to say, those pieces, and something that some other things I want to uplift, and just to say, like, these statistics, have, like, in some ways, like, recently, became more apparent, and things have been happening, going back to infant mortality, maternal mortality. It was, happening for some time, but how were we able to track that?
Yeah.
So in 2016, the Tennessee legislature passed legislation. So Representative Harold Love carried the bill to establish a maternal mortality review board to collect and aggregate data on the causes and incidences of maternal mortality. And so he worked, closely with a doctor by the name of Dr. Connie Graves. And so just to say that before 2016, maternal death was not tracked by the state in a way that would be useful for prevention. And
Yeah.
so, it was not helpful as we thought about, like, okay, how can we prevent
Yeah.
maternal mortality deaths? And so that review board has really been, helpful in, like, what are the data points where, like, causing maternal mortality deaths in Tennessee. And each year they release a report, and definitely encourage people to check those reports out. If you just, like, type in Tennessee Maternal Mortality Review Committee or board, it should come up. And
Okay.
so, for example, they have, like, this graphic on their page, and I just will read some of it for people. So during 2017 to 2018, 46 Black women in Tennessee died while pregnant or within 1 year of pregnancy. And they deemed that, like, during this year that, like, the data points come from, 100% of the pregnancy related deaths to Black women were determined to be preventable.
Mm.
And then from that, Black women in Tennessee are 3 times as likely to die from pregnancy complications than white women. And, some of the top causes were heart disease, preeclampsia, infections, homicide, etc. And so just like with those, like, conditions, going back to how, like, you can catch them, but, like, why is it not happening?
Yeah.
And when we think about, like, what, like, really is causing these rates, it comes back to racism, just point blank, period. And when we think about, like, the history of the medical system, and also how, OB/GYN services, like, push into, like, the medical field, before midwives, deliver babies. And it was, they provided comprehensive sexual and reproductive care. And they were able to, really, because they were of the communities,
Mhm.
were able to provide, like, care that was, like, culturally responsive and sustaining. And, doctors, started this campaign to discredit them, and, make them seem like they were, like, not competent and dirty, etc. And, just push, like, births, like, happening, into the hospital setting.
Yeah.
And we know what happens in the hospital, again, like, how, like, just the system was founded on white supremacy. And
Yeah.
that it really is what is driving things, because we know that across class, Black birthing people still have these experiences, going back to, like, Serena Williams, and folks really having to fight for their lives.
Yeah.
And so just to say that is, like, what is at the core of continued experiences with white supremacy, like, deeply entrenched, deeply embedded within a medical system.
Yeah, absolutely. There have been, like you said, with Serena Williams, and the more high profile cases, I think are, they're shedding some light and really just bringing some awareness to it. But I agree, it's all racism. We just see, I actually have friends who said that they experience situations, And, she's saying, well, I'm hurting. It was like, oh, well, it doesn't hurt that bad. Well, who are you to
Mhm.
say? So
Yeah.
there's this idea that Black women have a higher tolerance for pain and all of those different things. So yeah, like I said, I really appreciate you shedding some light on that and really giving some statistics so people are aware. And so with that being said, I know you all do a lot of advocacy work. And so what does advocacy look like when we talk about Black maternal health and infant mortality?
Mm-hmm. I would say like one big piece going back to Black Maternal Health Week is like this awareness, because I think like there is so much more awareness, now. But I remember when I came into this role, or like when I was in the co-executive director role and I came into it in 2017, I didn't really know like much about this.
Yeah.
And when like the week started like that next year, the first week happened in 2018. I just like learned so much. There was this documentary, Death by Delivery, and it just featured like so many players, including doulas. And I was like, oh my goodness. And it's so interesting because like so many of the women in my family had like complications during pregnancy. And, thank God they're still here, but they like had, some of them had like these near-death experiences and not, being listened to and ignored. And I think I just didn't like connect all the pieces. So just like the awareness and like participating in the week as a part of like, the beginning steps
Yeah.
of advocacy, just like shedding light on this. And I think sometimes people are like, oh, like, yeah, that happens. So, when we think about statistics and we are able to rattle them off. But,
Yeah.
sadly, I do know people like, just kind of like thinking about degrees of separation who weren't that
Yes.
far from me, who did die, while like, shortly after delivery, or, something happened. So just to say that like it hits very, very close to home. And so I think the education piece is critical. And again, highlighting like what really is at the core of this is so essential. I will also say like, with our advocacy, we've been really big on pushing for expanded doula care, access to doulas. And so there is like, lots of research out there that shows that, just like having a doula in the room, just present in the room, can improve birth outcomes. And we're not saying like, doulas are gonna fix, maternal
Right.
mortality, because again, it's like an issue of white supremacy. And also they provide support that can be so critical when it comes to like what happens to that birthing person. And so we have for a few years now have been working closely with a few doula collectives. So Home and Heart Birth and Wellness Collective based here in Nashville, Birth Strides based in Memphis, to really think about TennCare, eventually trying to get to TennCare coverage of doulas being able to like receive reimbursements from TennCare for the support, the essential support that they provide. And so
Absolutely.
we've been working on legislation related to that for a few years. So we first started with doulas being recognized as essential members of the birth team. And so this was, 2021. And there were some people like, what is a doula, right? And some folks like, oh, a doula is a midwife. And it's like, no, a doula is providing non-medical support. A midwife is providing medical, support. The training is different. And, just the different conversations we had just to like, so people, knew what a doula was. And then also uplifting community-based doulas, because that's community-based doulas like represent the communities, that they serve. So thinking about marginalized communities, Black communities, and I think it's so beautiful. I'm thinking about a group of doulas in Memphis. They became doulas because they had a doula or wanted a doula when they were pregnant, and it like was kind of like this community they were able to build out. So like they know the and have the interest of like other like Black birthing people like at heart, because they know the experiences, they know the things like Black birthing folks navigate. And so like with conversations about doulas that's happening nationally, something that's kind of been like a big barrier is like certification. And so different legislatures want to pass like legislation,
Yeah.
seemingly like it's good to like, enable doulas to receive reimbursements through like the state Medicaid program, but they attach it to certification, typically from like these national doula agencies that have
Yeah.
been traditionally white, that
Yeah.
have approached like the training, like their curriculum from like a culturally responsive perspective approach. And a lot of these like Black community-based doulas, they don't, it's not even like there are for sure like financial like barriers. Like,
Yeah.
I was like going to try to like be donor certified, and that's like one of the top agencies. And it was gonna cost quite a bit of money when you go through all the things you need, the text you have to read, all
Mhm.
of that. It can like get up into like the thousands of dollars. And also going back to like how like up until recently, like these doula agencies didn't really like speak to the like conditions that Black people were navigating, that communities
Yeah.
of color were navigating. And
Mhm.
so, like, rightfully so, so many community-based doulas, they didn't want to be donor certified.
Right.
But it's like if they didn't, they, that was tied to their ability through like legislation that people were proposing or passing in other states. It was tied to their ability to like be eligible for reimbursements. And
Yeah.
so we were really intentional about that. We were like, we want to like, center community-based doulas because we know, like, again, that they're providing support for communities that are disproportionately impacted by infant mortality, by maternal mortality. And so we've, been taking it at a pace that censors them every step of the way. And we've had to say no to like some legislation that's, been proposed because it's like, hey, like, we want to be very clear. Like when it comes to like certification, it has to be done in a different way. And so again, we like first worked on the resolution to recognize doulas as like essential members of the birth team. Then legislation related to establishing like a committee that's composed of a variety of members, including doulas, to establish like standards specifically to Tennessee, and like Tennessee developing like some type of body to like certify per se, like doulas, so they could be eligible for reimbursement. And so it's still like a journey, but like we definitely welcome people, into like the advocacy
Yes.
work. And, there are other things that have been introduced in the past, like one year, like recognizing Black Maternal Health Week, by
Yes.
the legislature. That didn't pass. And so people can push for that, like, having it recognized by the state. There's so many like example bills
Mhm.
that we can push for in Tennessee to really think about some interventions when it comes to combating Black maternal mortality. And so there's like advocacy there. But again, I definitely want to like stress the education piece
Yeah.
and sound an alarm about this because it is an emergency. It's a crisis. We
Absolutely.
need to treat it as such.
Yeah, absolutely. And so that really highlights, I guess, for us to have relationships with our legislators, so our senators, our representatives, and
Mhm.
make sure that they understand what our concerns are when it comes to that, and really just connecting them with you all since you're front and center doing the work and just saying, hey, this is what we want to do, this is who we want to support, and this is the work that is important to us. So again, I really just thank you for all that you do. And then for the last, I guess, question that I have is what can we specifically do to support your organization and the work that you do? I know y'all do Days on the Hill and all of these different
Mhm.
things. You write legislation, which I think is beautiful. But if, like for me, if I want to get, frontline, boots on the ground, what do I need to do to really become more engaged in this work?
One, I would, definitely encourage people to join our listserv, and you just go to healthyandfreetn.org to like receive like our updates and, calls to action, requests for support. Follow us on Instagram. It's Healthy Free TN. We post like a lot of like good information, in my opinion. I know I'm biased about like these issues. And I will say we are trying to move more into organizing because that's essential. So like, yes, like we want to think about changing policies, but we want to be able to build enough power where like, one, we could put more pressure,
Absolutely.
but we can also like start to think about like, building out, going back to that other piece of what I've said, like, that's critical to our mission, working to dismantle harmful systems, but also working to like build like supportive structures. And so I think about like things that are being done to like also expand like midwifery access, like interest in like home births, just like other like things related to like, healthcare and, I already mentioned that. So we need a base of people to be able to like, push those things and also like work on alternative things. Like I know some people have interest in coming together and like, oh, like what would it look like to kind of build out like mini centers or people having access to different like resources, maybe they just like related to like diapers and all of those things, right? To make sure like we're like supporting people with their pregnancies like all the way through. So just to say that's like something else, like people like sign up and remain connected to our work because we're hoping to like kind of really lean more into that, especially in the next like year or so. And so that's like a big piece. Like you said, we have like annual days on Hill. Our day on the Hill for this year was a few weeks ago, but you're on our listserv, you'll see the information for next year. We have some other upcoming events. We are convening a coalition, a statewide coalition, and people are welcome, to like hit us up to like get connected to that. And depending on where you like, your role, like their space, like if you're a doula, and especially if you're a doula, we would love for you to be a part of our network. And so one immediate event that's coming up is next week. We're going to do kind of like this Black maternal health like roundtable, and definitely can like get that information out. So it'll be next Friday from 12 to 2 p.m. And definitely can send that out as like a follow-up for people to see, to like, again have like a more in-depth conversation and like what people can do to really push this issue.